Welcome to a comprehensive guide on common ear, nose, and throat diseases, also known as ENT disorders. We'll delve into their causes, symptoms, treatments, and prevention strategies. ENT disorders encompass a broad range of conditions that affect our ability to perform vital functions like hearing, breathing, and speaking. They can be as minor as a common cold or as severe as cancer, impacting not just our physical health but also our quality of life. In this enlightening journey, we're going to explore some of the most common ENT diseases, demystifying their treatments and arming you with prevention strategies. We'll tackle ear infections, sinusitis, tonsillitis, laryngitis, and more. By understanding these conditions better, we can promote healthier habits and proactive healthcare practices. So, buckle up as we begin our journey to understanding these prevalent ailments better. Starting off with ear infections, a common condition affecting both children and adults. Ear infections occur when a bacterial or viral infection affects the middle ear, the sections of your ear just behind the eardrum. They can be painful because of inflammation and buildup of fluids in the middle ear. There are various causes of ear infections. They often occur when one has a cold, the flu, or allergies, which can cause congestion and swelling of the nasal passages, throat, and eustachian tubes. Young children are more prone to ear infections because their eustachian tubes are shorter and more horizontal, making it difficult for fluids to drain out. The symptoms of an ear infection can vary in severity, but they generally include ear pain, diminished hearing, a feeling of fullness in the ear, and in some cases, fever. In children, you might notice tugging at the ear, increased crying or irritability, difficulty sleeping, or balance problems. When it comes to treatment, it's best to consult with a healthcare professional. Depending on the severity and type of infection, your doctor might prescribe antibiotics to fight off the bacteria. For pain management, over-the-counter pain relievers such as ibuprofen or acetaminophen can be used. It's also essential to rest and hydrate to help your body recover. Now let's talk prevention. To help prevent ear infections, avoid smoking and exposure to secondhand smoke. Wash your hands and your children's hands frequently to stop the spread of germs. If you're prone to allergies, manage them with the help of your doctor. Also, if you're swimming, use a swimming cap or earplugs to keep water out of your ears. Remember, prevention is better than cure, so keep those ears clean and dry. Moving on to sinusitis, a condition that millions around the world struggle with. Sinusitis is the inflammation or swelling of the tissue lining the sinuses. This inflammation can obstruct the sinuses, causing mucus to build up and potentially leading to an infection. In many cases, sinusitis can be triggered by a common cold, allergic rhinitis, nasal polyps, or a deviated septum. The symptoms of sinusitis can vary from person to person, but common signs include a runny or stuffy nose, facial pain or pressure, loss of smell, cough or congestion, and possibly a fever. You may also experience fatigue, dental pain, bad breath, and a reduced sense of taste. If you're experiencing these symptoms, it's important to see a healthcare provider. They may recommend treatments ranging from simple home remedies to prescription medications or, in severe cases, surgical intervention. Home remedies can include nasal irrigation, steam inhalation, and staying hydrated. Over-the-counter medications can help with pain and inflammation, and if the cause is bacterial, your doctor might prescribe antibiotics. In severe or chronic cases, surgery may be an option to remove any obstructions and to allow the sinuses to drain properly. Now let's talk about prevention. It all starts with good hygiene. Regular hand washing is paramount to preventing many infections, including sinusitis. Avoid close contact with people who have colds or other upper respiratory infections. If you're prone to sinusitis due to allergies, try to avoid triggers and manage your allergies with the help of your healthcare provider. Also, don't smoke and avoid secondhand smoke as it can irritate the sinuses. Keeping your immune system strong is also crucial. This means eating a balanced diet, getting regular exercise, and ensuring you're getting enough sleep. A strong immune system can fight off infections before they take hold and cause problems like sinusitis. So there you have it. Sinusitis is a common condition, but with the right knowledge and by taking the right precautions, you can manage and even prevent it. Remember, the health of your sinuses is in your hands. Keep those sinuses clear and remember to wash your hands regularly. Next up is tonsillitis, a common throat infection, especially among children. Let's dive into this condition that involves inflammation of the tonsils, the two oval-shaped pads of tissue at the back of the throat. Tonsillitis is typically caused by viral or bacterial infections. Viruses like the common cold or flu can often be the culprits, but bacteria, such as Streptococcus, the bacteria responsible for strep throat, can also lead to tonsillitis. When someone has tonsillitis, they might experience a sore throat, difficulty swallowing, and swollen red tonsils, often accompanied by white or yellow patches. They might also have a fever, bad breath, or a scratchy voice. In children, symptoms can be a little different. They may exhibit fussiness, reduced appetite, or excessive drooling if swallowing hurts too much. So, how is tonsillitis treated? Well, it depends on the cause. If it's a viral infection, the body will usually fight it off on its own. Rest, hydration, and over-the-counter remedies for pain and fever can help alleviate symptoms. On the other hand, if the infection is bacterial, a healthcare provider might prescribe antibiotics. In severe or recurrent cases, a tonsillectomy or surgical removal of the tonsils might be recommended. Now, prevention is always better than cure, right? To prevent tonsillitis, it's crucial to avoid close contact with those who are sick. This is where good hygiene comes in. Wash your hands often, avoid sharing food, drinks, or utensils with others, and cough or sneeze into a tissue or your elbow to minimize the spread of germs. Tonsillitis can be uncomfortable, but with the right care and preventive measures, it's something we can manage effectively. Always consult with a healthcare provider if you or your child have symptoms of tonsillitis. Remember, early detection and treatment can make a world of difference. Stay healthy and keep those throats clear. Finally, we have laryngitis, a common condition that can make speaking a painful task. Laryngitis is an inflammation of the larynx, also known as the voice box. This often results in a hoarse or weak voice, and in severe cases, it can lead to a complete loss of voice. It's a common condition that can strike anyone, regardless of age or gender. So, what causes laryngitis? Well, it's often the result of a viral infection, like a cold or the flu. However, it can also be triggered by overusing your voice, such as shouting at a concert or speaking for long periods without rest. Now let's talk about the symptoms. Aside from a hoarse or weak voice, other signs of laryngitis include a dry throat, a tickling sensation in the throat, and even difficulty swallowing. In some cases, it may be accompanied by a mild fever or a persistent cough. If you suspect you have laryngitis, it's important to seek medical attention. While it often resolves on its own within a week or two, persistent symptoms can indicate a more serious condition. Treatment options depend on the cause and severity of your laryngitis. For instance, if it's caused by a bacterial infection, your doctor may prescribe antibiotics. If it's due to voice strain, you'll likely be advised to rest your voice. Prevention is key when it comes to laryngitis. The best way to prevent it is by not straining your voice. This means avoiding yelling or speaking loudly for extended periods. It's also important to keep your throat moist by staying hydrated and using a humidifier if necessary. In addition, maintaining a healthy lifestyle can play a significant role in prevention. This includes not smoking, avoiding secondhand smoke, and limiting your alcohol consumption. So there you have it. Laryngitis can be a pain, but with the right knowledge and precautions, it doesn't have to silence you. Protect your voice box and remember to rest your voice when needed. As we wrap up, let's quickly summarize what we've learned today. We've tackled some common ear, nose, and throat diseases, their treatments and preventive measures. First, we discussed ear infections, which are often caused by bacteria and can be treated with antibiotics. To avoid them, it's crucial to keep your ears clean and dry. Next, we explored sinusitis, an inflammation often treated with nasal decongestants and steam inhalation. Regular nasal hygiene is the key to prevention. We then examined tonsillitis, typically caused by viral infections. Treatment can range from rest and hydration to, in severe cases, surgery. Tonsillitis can be prevented by avoiding contact with sick individuals and maintaining good overall health. Finally, we delved into laryngitis resulting from vocal strain or infection. Resting your voice and staying hydrated can help treat this condition. To prevent laryngitis, avoid straining your voice and practice good hygiene. Remember, early detection and treatment can prevent complications. Stay informed, stay healthy.